The pandemic has really created the second public health crisis. And that second public health crisis is really in terms of behavioral health needs.
For many people, it's the first time they've ever been socially isolated. And with social isolation comes anxiety, there comes worry about what does tomorrow bring for me. And then the next step is going to be what's going to occur if those things don't come back to what they were previously.
Since the COVID pandemic began in Montana, calls to 211 have more than doubled. We have around 24,000 calls in a typical year on all of our lines, and we've seen an overall call volume increase of 20% in the last few weeks.
The unintended consequences have been significant in terms of the psychological impact, and we believe that we'll continue to see those psychological impacts well after we have conquered the COVID-19 pandemic. A partnership was formed with Western Montana Mental Health Center, the Help Center, and Bozeman Health to form an urgent care center for individuals who are having feelings of psychological distress, for individuals who may be having a psychiatric emergency or feel like they are overwhelmed with all of the isolation and the stresses that are being created by COVID-19.
Most people are driven through 911 when they're in a mental health emergency or they just don't know where to turn for assistance. However, what we know is that people fear using 911 services. And so as a result, now people can say, I have a third choice. If I'm in an emergency and or I just don't feel very well today and I need to go and have help now. And so this allows people to be able to access the now in critical care and as a mildly or moderately depressed or anxious individual or seeking services that otherwise they need in the community.
If you're experiencing a mental health crisis or just need help, call 211. And if it's appropriate for your situation, we will connect you to the behavioral health urgent care.
These individuals can come and get the immediate assistance they need either by telehealth or they can come on campus as a walk-in.
They could expect to see a trained licensed professional, whether that is a medication provider or a licensed therapist. We also have a pharmacy here, so it's really a one-stop shop.
Bozeman Health Foundation has been so generous in providing us the startup funding for the Behavioral Health Urgent Care Center. For those individuals who don't have insurance or cannot afford to pay for mental health services now, they will help offset the costs for those individuals because we want to make sure, and the foundation wants to make sure, that everybody in the community, regardless of their ability to pay, gets help.
We've long known this is needed. People have asked for it. We know that being able to access your health care of any sort is vital and important. We wouldn't ask people who are having heart attacks to not show up at the emergency room. And here we are asking people who are depressed and anxious and lonely and isolated not to be able to reach out when they need to.
Not only will it be a benefit to the citizens of Gallatin County, so that they have immediacy of access, it'll also help law enforcement so that they can do what they do best, which is to protect and serve by being able to bring a patient here and drop them off. And finally, it's certainly going to help the emergency department. In this pandemic, they do not need to be seeing patients that could easily be seen someplace else.